suckle leaves up every day. So maple leaves get emulsifies, I mean, it'll suck.
Yeah, we have to go over twice to get everything out. Our walker just sometimes doesn't like anything.
We are recording.
There's not usually, yeah, there's not usually
We
any.
are live. All right.
Lights,
Okay.
camera, action.
All right. We all set then? All right. If we could rise for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening, everyone. I have just one statement that I need to make. The Board of Selectmen is holding these budget workshops, these workshops to discuss budgets with our department heads. While these meetings are open to the public, they are workshop meetings and not intended to solicit public comment. The board may, at their discretion, accept some public comment, but they are not required to do so. The public may make public comments on the budget at the public hearing, which will be held in January after the Board of Selectmen and the Budget Committee have reviewed the budgets, okay? Our first order of business is health agencies, which is number 4, guys, in your book. And the first item on the agenda is the South Road Cemetery, which is usually what I speak to. As we all know, we were in a default budget, and the board of the association at the South Road Cemetery very nicely changed the amount to $5,000 to accommodate the default budget or help give back in regards to the default budget. They have again brought this for the coming 2025, requested the $8,500. Obviously, you know, things are a little tight, and that's been a figure that we've tried to carry for a few years, even with expenses increasing. I guess if anybody has any questions, I'll try to answer them.
I'd recommend that it stay at 5,000. I don't approve of the increase. At least that's my theory about it,
Okay,
but I wanna.
yeah.
I mean, do you guys, I don't wanna get too much into the financials that we were given of it, but do you guys feel that it would be harmful to the South Road if we were able to do the 5,000?
Well, let's put it this way, we have a superintendent, obviously, that cares for the cemetery, and he did not receive an increase last year, and it's his own equipment, his own fuel, everything, so he's going to be looking for an increase, which he deserves, obviously. And again, we've kept it at the 8,500 for, I'm not sure how many years, and it definitely did affect the bottom line, losing that $3,500.
Yeah, I was thinking more along the assets. You guys have anything enough to cover if it was to be happen to have a big
Well,
loss of
obviously,
$3,000
what
or $2,000?
happens is that when you sell lots, a half of the lot monies go into perpetual care, okay, which is invested forever, for long term, okay, so we try to obviously keep our budget pretty low so that we're not affecting the long-term care of the cemetery. And I know this year, even though we had the lower budget, we still did some work on old stones that have tipped over or whatever, and so we still did do the same amount of what we call extra maintenance to keep those things up. That's part of your perpetual care. And we do sometimes pull money out of perpetual care. Well, we haven't, but we would have to if we were going to do any improvements such as that for the following year, because we won't have the funds available.
Would it be wrong of me to ask how much money's in perpetual care of your organization?
I can't answer that right off, that's held by the trustees of the trust fund, I don't have that figure right off the top of my head. Then we have a couple other small accounts, I think one has like 30 in it, I can't remember what the other one has, but we have a couple other invested accounts. But these are monies that people have given for perpetual care
Yep.
for, obviously, forever.
I understand it, but they're also interest-bearing accounts, I assume.
They are, yep, we hope as long as everything keeps moving forward and there's not a downfall, yes. I think we get about $200 and something a month from those interest-bearing accounts. Not huge monies by any means.
Chairman Rooney, may I add?
Yep.
So the number that you see in your 24 actual,
Yep.
if you remember when we went after the default, we had, we made additional cuts to everyone's requested and default numbers.
Yes.
So those numbers that you see in the actual are what the board cut all of the health agencies down to. So she requests, so everyone, so I know there was a comment made about not increasing. So she requested the Southport Cemetery requested the 8,500 in 24. They're not increasing. The 5,000 is that reduction that we cut everyone down to.
Yeah, I'm not trying to be a
Make up
Scrooge
for
to
that.
South
No, they're
Road,
not.
I'm gonna be the same way to
And
every
I
one of these
believe-
agencies right now.
Right,
Cause
and-
we need to have a budget we can pass.
Back in March, that's
I've
why.
said it 100 times.
And I believe that we voluntarily reduced it to 5.
Yes.
We were not asked to reduce it to 5, we did that to help with the budget.
The budget, yes.
The budget shortfall, yep, that we did.
I have no more questions, I'm just thinking.
Yep, that's all right. Sharon, any questions from
Oh,
anyone
no.
else?
I'm good.
No?
You wanna vote on that line?
Do we wanna vote on or just vote on everything? Well, it doesn't, it's up to you.
Well, they're all
Someone would like.
they're all separate.
Yeah, they're all
right?
separate, if someone would like to make a motion.
I'd make a motion to accept the 5,000 that Sonny put forward.
I'll second it.
Okay. And I need to abstain from the voting, all in favor?
Aye.
I'm gonna abstain too, cause it's a cemetery. Please.
Okay, so you're abstaining also, Shannon?
Yes.
Okay, all right. Okay, the next one is Granite VNA. Is someone here from Granite VNA? All right, hello.
Hi, my name is Sarah, and I'm here to represent Granite VNA Services for the amount that, I'm sorry, could you move forward to the table here? This is where everything is being recorded
Oh, is
on
it? Oh, all
this
right.
sheet right here, if you don't.
Have a seat there.
Thank you.
All right. I didn't realize that either.
That's okay. I'm happy to say wherever's conducive for the board. Well, good evening. Like I said, my name is Sarah, and I'm with Granite VNA Services, and I'm here in support of the amount that was awarded to the VNA last year in the figure of $22,000. Granite VNA has been a nonprofit agency in the Lakes region supporting home care, hospice, palliative care services, maternal child health and pediatric services, as well as community health services. The amount that goes in support of the VNA helps those without insurance or private funds and to cover the costs that are not supported by other funding services. In conjunction with the amount that we receive from the support of the towns, we do also conduct our own fundraising activities to be able to support those who are in need. Some of the community health clinics that go to support the community directly include influenza clinics, blood pressure and foot care clinics. For pediatric and maternal child health programs, we offer those to families with young children who are considered to be socially or medically at risk, including problems with developmental disability, premature birth, adolescent parents, alcoholism, and chronic illnesses. Hospice and palliative services that are not reimbursed by third-party payers also help to support adult and childhood bereavement programs for those that are suffering from a most recent loss. In addition to that, we also provide volunteer services provide, programs in the community for those who are experiencing a loss or most recently had a loss. Home care services provides skilled nursing services, physical therapy, occupational therapy, speech therapy services, and home health aides, as well as social workers, so that people can live healthy, productive lives in their homes. I'm happy to answer any questions that you might have with regards to grant EMA lines of business.
How much did you actually spend year to date?
I don't know that figure I don't have, sir. I have more accurate figures when it comes down to patient delivery of care. Home health services, we provided 4,771 visits.
I'm looking at for a dollar value.
I don't have a dollar figure, no, sir.
Thank you.
And are those numbers in Belmont? Is that what you're?
That's in
okay.
Belmont, yes, sir. We actually just started our fiscal year October 1st.
Okay.
So we just closed our fiscal year.
Sure.
Chairman.
Yeah, I'm sorry.
Are you guys able to earmark the money so we know it's for Belmont residents, or is it just a general pool? Cause like with Lakeshore Mental Health, we know they can earmark it for Belmont residents.
Right, so, this, I believe, I cannot speak specifically to that. That would be more appropriate for our, CFO or our accounting department. I'm here more to generally speak about the services and the monies that we received directly in support of the VNA.
How many offices do you have?
We have 3 offices, ma'am, one in Concord, one in Wolfboro, one in Laconia.
Any other questions?
The number of 16.5 that says actual, Alicia, is that year to date or is that a continuing number?
That is,
That's what we cut to last year.
this is what we've cut so far in '24.
Okay.
Was that the full amount we cut it to last year?
Yes.
Okay.
Not last year.
Well, last budget.
This was, the actual is what we reduced their request, their 23 default by.
Okay.
And then, so everyone has already, requested all of their funds and everyone has been given their funds for
Okay, so that's the actual numbers there. Okay.
And they all ask them in one lump sum, not disbursements.
Okay.
So my question is going through the Town of Belmont information sheet, the things that are community-based, the foot care clinic doesn't have anything, the blood pressure clinic doesn't have anything, community health and education and flu immunizations, there are no numbers there anymore, and there was last year, I believe, if I'm not mistaken. What happened to those?
Ma'am, I'm not the best person to be able to speak to that directly.
Okay, thanks.
What is the next one? I don't get this, the next one.
That was because we didn't fund them last year.
Do we have any other questions? Does anyone want to make a motion, or?
I'll make a motion to keep it at last year's default budget at 16.5.
Do I have a second on
I'll
that?
second that.
Okay. All in favor?
Aye.
Aye.
Aye. Sharon? No. Okay. Okay, 16.5? Okay. Lakes Region VNA.
Hello.
Oh. Oh, I'm sorry. There you go.
Hi, my name is Dr. Erin Dosky. I have the privilege of serving as the new CEO of Lakes Region VNA, and I'm joined by Jennifer Boyce, my financial director. By way of background, I am an internal medicine primary care provider for more than 20 years and have been in the digital health, particularly around health equity space, for the last 10 years. I've served on the Lakes Region VNA board for 3, and this past spring took the helm of CEO. And I wanted to give you a little bit of background as to why. It's not necessarily a traditional for a primary care doctor to make. And I can honestly say that over the course of my clinical career, my heart has been slowly broken by seeing what has happened to primary care, the lack of continuity, the lack of relationships, the poor communication, the sicker patients leaving the hospital all feeling under-resourced to provide for them. And so my career post laying on of hands has been very much about how to build that back. It is an overwhelming task. I think we can all agree that healthcare is broken in many ways. And part of what really spoke to me about the Lakes Region VNA is for more than 100 years, they have provided very much those very things that attracted me to primary care to begin with. So in taking on this responsibility, I hope very much to see that spirit of continuity of care, of living with dignity and in health and wellness, and to be able to age in place as something that is incredibly precious, that we are wholeheartedly committed to. Which is why this time we are asking for your support in our ongoing ability to serve our community in several different ways, both the external community and the internal community of Lakes Region. This year we provided the town of Belmont with more than 1,400 visits. A portion of that, and I cannot give you the exact dollar amount, has been in charitable care, as we are committed to serving anybody regardless of their ability to pay. Like my prior speaker at Granite, we too provide home care and hospice services, as well as rehab, as well as grief and caregiver support. We also endeavor to support the community in terms of wellness with the provision of flu clinics that have just begun, as well as working with several different senior centers to provide blood pressure monitoring, and are about to embark on a foot care clinic as well. Internal, what I mean by where your contribution goes to is I'm very committed to the professional development of both those who are interested in pursuing careers in healthcare, as well as the professional development of our staff. And so we have a tuition reimbursement program to ensure the professional development of our staff so they can continue to provide the highest quality care to this community. And externally, every year we support scholarships for graduating high school seniors who are looking to pursue careers in healthcare. So I'm happy to answer any questions that you may have about either our mission, values, and certainly anything specific about our interactions with the community.
Questions?
The only thing I would add is that the reason you see the 0 in the actual is because they did not have a request in the 23.
That's what I thought, yeah.
So the default for 24 was what the 23 was, and since there was no request, that's why that's a 0.
And from the notes from Franklin VNA, it looks like Lakes Region has more visits to our town than Franklin VNA does.
Mhm.
I recommend we reduce that 5,000 to 2,000.
I'll second that.
It is a motion to reduce the 5,000 to 2,000, and Sunny seconded. All in.
He was a primary, I second.
Oh, I'm sorry. I got it backwards. Sunny made the motion, John seconded. I'm sorry, backwards. All in favor?
Aye.
Aye.
Any opposition?
Me.
Okay,
It's
Sharon.
it's $1.38 a visit. They did 1,440 visits to the town of Belmont for care for our seniors. And $2,000 is $1.38 a visit. I don't think their $5,000 request was unreasonable, especially since it's the first time they've come to us asking for assistance.
There's a couple more down there that I want to get rid of.
Yeah, okay. All right, thank you, thank you, Sharon. That motion passes. Okay, we'll move on to community action. Is someone here for community action? Good evening, ladies. Where'd it go?
I'm Beth Hayward. Nice to see you all again.
Yes,
This
yes.
is Kristen. Kristen is our new director of our resource centers. So she's coming to all these meetings with me, and hopefully next year you'll see her on the face.
All right.
First, I just want to say thank you to the town of Belmont. You guys have supported us for years and years and years, and it's very much grateful. The things we do, we wouldn't be able to do if the towns and our two counties didn't support us. It just allows us to do so much more than what our federal, state funding allows us to do, so thank you.
We also stayed with what we requested last year, which was the 15. I do know, I think we received a little less than 10 with the cut.
Yes.
And so we are requesting the 15,000. What you will see in what we provided this year, though, is a little different than we've done in previous years. We usually stick to our fuel, electric, food pantry, weatherization, and housing. But we determined we really wanted to give towns our full economic impact, so we can provide to you all of the services that CAP has provided to Belmont residents. So if you see all of a sudden it looks like it's 1.1, that's because it's all CAP and not just the 6 programs we usually give you guys information for. So we did this across the boards, and honestly, we did it so we could have a better understanding of, you know, what towns are needing the most services and what towns aren't. So that is different from last year, previous years. And overall, I can tell you that we served 915 Belmont residents, 1,076 households, and a new thing this year is we did meals, since we have many programs that provide meals. We provided 18,273 meals, and a total amount of services provided is 1.1 million, a little over 1.1 million. And so, just more information for you guys to have at your fingertips. So I'd be happy to answer any questions.
I just have a quick statistic question.
Sure.
How would you have more households than people? Do you count the households for different programs?
Yes.
Okay.
Yes, thank you for asking that. I will tell you, I put these together and I went back 2 times to my data person. I'm like, it's not mathing. And she's like, it's dependent on the program. So
Okay.
that is fine. Some programs federally have to do just households, some
It
people.
took me a little bit to think of that,
Yeah.
and maybe that's it.
Yes, that is it.
The meals,
Yes,
that's not like Meals on Wheels.
it's all of them. Meals on Wheels, congregate, so people that come to our senior centers and have a meal at home. And then it's also food box meals that we do. So it's all of the programs. It's not broken down by program.
Okay, all right,
Altogether.
okay, all right. And you still have enough volunteers for the Meals on Wheels too?
I mean, we could use a few more drivers.
Sure.
I would say for sure. We have some really amazing people that have stepped up to help out, and now it's been like 2 years of them helping out. So we're lucky that we have that.
Yeah.
But we are always in need of Meals on
Of
Wheels
course.
services, for sure.
But as you know, we definitely having a budget problem in the town of Belmont.
Yes.
It was defaulted last year. So we're trying to cut back so that the taxpayers won't harass us again, because we really don't need that.
I understand that completely.
So I'd recommend 13,000, go back to the 13,000 on the default figure.
That's
That
very
would,
much.
that would be my motion.
I'll second that motion.
Any other discussion? Travis?
No, I'm good.
Karen?
No, I'm good.
All right. Could I have a vote? All in favor?
Aye.
Aye.
Any opposition? Hearing none, we'll do 13.
Thank you so much.
Thank you, ladies.
Take care.
All right. Anyone here from CASA? I hope I'm saying that right,
I've seen
CASA?
her before. She's like that again. She's from accounting when she CASA came.
CASA. Good evening.
Good evening, my name is Tara, I'm with CASA, Court Appointed Special Advocates. We provide volunteer legal aid to abused and neglected children. CASA volunteers only speak for the child when they go to court for their abuse and neglect case. We're only there in the child's best interest, and we currently have 12 cases involving 17 children from the town of Belmont. It fluctuates. The last 2 years it's been between 16 and 18 kids. The cases that we're seeing specifically in this region and north are lasting longer because of the severity. So volunteers are taking less cases to focus on the ones that they do have. Our volunteers are meeting with the children monthly. So whether a case has 1 kid or 5 kids, it's 1 volunteer per case. And this 1 advocate is visiting wherever the children may be in Belmont, either if it's a foster family or they're in a family setting but removed from their normal home. So aunts, uncles, grandparents, that sort of thing. So the CASAs are going wherever the kids are in town to meet with them monthly. They're asking their teachers how they're doing, their foster family. and then reporting back to the judge, on the best interest of what would be good for the child.
And how do you get, how do I say this? How do you come in contact with the child? Is it through the police department or?
So CASA is appointed by the court once there's been a finding of abuse or neglect.
Okay,
So someone makes an anonymous call to DCYF or their police station or something. DCYF does their investigation,
okay,
present their findings, they bring it to the court. The judge decides that yes, this is an abuse or a neglect case. At that point, CASA is involved.
okay, all right.
Yeah, I have no issue with the 500 for CASA.
No,
Nor do I.
okay,
I'll make the motion to,
all right. And do you want to second that motion? All right.
Second.
It is, we have a motion to grant the $500, and we have a second. Any further discussion? No?
No, I think that's fair.
All right, all in favor?
Aye.
Any, no opposition? 'Thank you, dear.
Thank you so much.
All right.
Thank you.
Thank you for what you're doing.
Thank you.
Can't be easy. Waypoint. Or anyone here? Zoom?
Yes.
Waypoint?
Yes.
Yes, hi there.
Can you hear me?
Yes, we
Oh,
can.
Thank you very much. So my name is Borja Alvarez, and I have the privilege of serving as president and CEO at Waypoint. Waypoint is the oldest child-serving agency in New Hampshire. We were founded in 1850, and we serve around 8,000 families every year across the state. One of the things that distinguishes our agency is that we actually cover the whole lifespan. So we start with prenatal and early childhood services and go all the way to senior requiring support and home care services in the home to remain independent. In the town, we have received funds for many years, and we're gratefully and very thankful. And we're requesting this year also the same amount we received last year, which is $4,000. We have served about 12 families last year, but we also have a family resource center in Laconia where we actually don't count how many families really attend the groups and all the services that we provide, but it's really about prevention and well-being of families. So it is a much larger number, but we don't have to count because the office is open for the family resource center at different times during the week, and we have an influx of families that actually use our service. The two main programs besides the family resource center that we have in Laconia are healthcare coordination. That is a program that serves children with chronic health conditions from the ages of really firstborn to age 21. Our caseworkers actually stay with the family for actually 21 years. Some of the cases that they have are really very complex chronic health conditions, and these kids go in and out of hospital and in and out of care. And our workers are there to provide support to the families and accommodations to make sure that they can navigate the system. We also provide community-based voluntary services, which is sort of not as new of a program, but it's basically 3 years ago we started this program. And it is cases that actually get reported to DCYF, but don't quite make the cut because the abuse or the neglect is not severe enough to open a case. But there's concerns around domestic violence or substance misuse or mental health issues. And the research was pretty clear. Those families that were not accepted, let's say by DCYF, ended up coming back the next year in much more complex situations, requiring often foster care or the kids to be placed out of the home. So we have served several families in the Belmont area, in the town of Belmont, we have been able to prevent these kids by providing these prevention services to end up in sort of deeper end of the system, like foster care or group home. We are committed to prevention services so that we make sure that families don't require the level of care that at times is really traumatic and devastating in terms of the outcomes for the kids. I am happy to answer any questions you may have about the program or the agency or the kinds of services we provide. And thank you again for your support.
Any questions?
questions, just thinking,
You're thinking?
money-wise.
Okay. I bet they're requesting 4,000. Last year, with the default, we lowered it to 1,500.
I'd like to change that 4,000 to 2,000. That's my motion.
And I'll second that motion. I
Okay.
already wrote the number in.
Do we have any other discussion on that? No? Hearing none? All in favor?
Aye.
Any opposition?
Me.
Sharon opposes. The motion passes. Then, thank you very much. Our next is new beginnings. Good evening.
How are you?
Good, thank you.
Thank you for having me. My name is Shauna Foster. I'm the Executive Director at New Beginnings. As you know, we are your local domestic violence and sexual assault crisis center. We've been serving Belmont County since 1991 and appreciating support from the Town of Belmont for quite some time, so thank you for that. Town funding supports free and confidential services for children, teens, and adults whose lives have been affected by domestic violence and sexual assault. All services are free of charge, including our prevention education services, which are ongoing in Belmont High School. In the last year alone, we provided over 5,000 services to almost 800 individuals. And I think the service that we are most known for, and what is perhaps our most critical service, is our emergency shelter. In the last several years, we have been at or over capacity in our shelter. When an individual transitions out, we typically fill that bed within a day. It's unusual for it to go open for more than 2 days. In an effort to help better meet the needs of the community, we rented an office space on Main Street in Laconia to add additional rooms to our shelter. So we went from 4 beds, 2 baths, to 6 beds and 4 bathrooms in our emergency shelter space. As soon as we put the beds in the rooms, they were full again and remain full today. We also provide services to a 5-unit transitional housing facility in Meredith that is called Sadie Place. That is privately funded. It is open to residents of Belmont, but that's not where your dollars go. I think it's important to know that even after that emergency period, we are providing ongoing services to families as well. In addition to opening up space in our shelter, having that office downtown gives us more room for support groups, meeting space with multidisciplinary team members, like members of the sexual assault response team, of which Belmont PD is a member, and a space in the community for people to go. So our shelter guests can enjoy a little bit more privacy. People aren't coming to the door to meet with advocates. They're coming to our downtown space now. Last year, we provided 267 services to 51 residents of Belmont. It's important for you to know that we never require people to tell us what town they're from. So those are just folks who disclosed that they were living in Belmont. The number is likely higher than that. Services to Belmont residents included 6 bed nights in our emergency shelter, emotional support services, 1 accompaniment to the hospital for a sexual assault exam. Those can take hours of support, and our advocates stay with the individual throughout that process. Court accompaniment, assistance obtaining pro bono legal counsel, lethality assessment program calls, which is a partnership we have with your police department, material goods assistance, and cash assistance that was comprised of emergency transportation, financial support that can be like paying for someone's prescription, a small car repair, or first month's rent, and hotel vouchers. And that financial assistance amount totaled at $1,065.87. We did request $1,900 this year from the town, but I understand and respect that you're needing to make cuts. We're just grateful for any support that you are able to provide. I'm happy to answer any questions.
Any questions?
No questions, just wanna see a discussion on.
I make a motion to accept that 1,900. I think she's done a lot for this town, so I think it's, she should get the 19.
I'll second.
All in favor?
Aye.
Any opposition? Hearing none?
Thank you
Thank
so
you,
much.
All The American Red Cross?
Sorry, hold on. The American Red Cross sent a response, it said our staff and volunteers are currently working through the response to Hurricane Helene and are deployed down south. We are unable to attend the meeting tonight. They did provide, documentation that was in your book.
Yep, they did.
Saying kind of services.
I'd make a motion to accept their request at 4,000.
And I'll second that, because as we all know, turn on the TV, they need all the help they can get.
But I kind of have a question about the
Yes.
Red Cross, because I know that it says here that they had no disaster or emergency response in the town of Belmont this past year. But I was curious about the blood drives. Do they pay for that, or do the people who are sponsoring, you know, like, the Knights of Columbus and St. Joseph's Church?
Yeah, I don't
know whose expense that is, so I was just curious about
I
that.
can't answer that. I do know the Knights sponsor it at the church. I think they have one tomorrow, in fact, I believe.
Probably, yeah.
They do it quite a bit, but I can't answer that.
I'm gonna oppose it just because I think it should be a little lower this year.
Okay, all right. Travis thinks it should be a little lower this year?
I
You're
do
meaning
too.
like the 3 for what the,
Even the 3, I had a lower number on my page, but even 3, I just don't. It's a big corporation, I get they do a lot, but I haven't seen much in Belmont that I think that we should fully fund that request.
So you're bringing the motion down to 3?
Well, it's your
Well,
motion, I
it's
can't
your
change
motion.
it.
You
It's
can't
your
change
motion,
it.
you have to change it.
Only, you would have to amend it if you can't, he can't change your motion, so. Sonny made the motion, right?
Yes.
No, John
John.
made the motion.
Geez,
Now,
sorry, John.
all of a sudden, I'm saying to myself.
Let me write this down. Pay attention.
One of these two.
We'll see about it.
Do you?
I thought Sonny made it, to be
John made
honest.
the motion.
John's sitting next to
You're blaming Sonny for it.
Phew.
That's all
me.
right.
Sorry, Sonny.
I don't know what's going on here, I'm lost.
Who's in charge?
Not me. John made the motion
Yes.
to accept the
And you
4,000,
seconded it.
and Sonny
No,
seconded it.
you seconded it, Ruth.
Oh, I seconded, that's right, I seconded it, okay. And now you're questioning.
Well, no, I'm just saying I'm gonna oppose it not because I think it should be more. I'm saying I think it should be less. That's why I'm gonna say no on the opposition.
Okay, all right. Shall we take a vote on that motion? The motion is for $4,000. All in favor?
I oppose.
I oppose.
I oppose.
Okay, the motion fails.
So I'll make a motion that we give them $3,000.
Okay. Do I have a second in regards to that?
I'll second it just because it's closer. Just because it's closer.
Make your own motion.
All right.
I said you could.
Okay, we have a motion on the floor for $3,000 and a second. All in favor?
Aye.
Aye.
Aye,
So is that unanimous?
I believe so, yes.
Unanimous. 3. Lakes Region Mental Health. I did. I'm sorry.
That's okay. Hello, I'm Beth Bashman. I'm the Director of Development and Public Relations here at Lakes Region. And as you know, we serve 24 towns in all of Belknap and southern Grafton County. Last year, our therapists and professionals served 3,125 patients, although that number is on the low end because we actually implemented a new electronic health record starting June 1st. So we're having trouble marrying June's data with July's data to the end of our fiscal year. So the numbers I give you are likely higher, but they're definitely higher. So I'm giving you the low numbers. And that number doesn't include the other ways we serve our communities through community education, advocacy, and collaboration with other community agencies. Lakes Region Mental Health is a nonprofit private corporation Care Board of Directors. We provide integrated mental and physical health care to all ages, and their families, people who are living with and recovering from mental illness. We, as I mentioned before, we work in partnership with other healthcare providers, hospitals, law enforcement, corrections, courts, school districts, social workers, and public health officials, and together we're able to provide a continuum of care that improves the quality of life in the Lakes region. A couple of other things that I think I talked about last year when I presented to you, it feels like yesterday, by the way, is street outreach through our grant to benefit homeless individuals. We just finished our year one of that project, and once we have that data compiled, I'd love to come present to anyone in Belmont who wants to hear those numbers and how it's affecting Belmont residents. We also operate here in Laconia the Belmont County Warming Center that opens during cold weather. And in fiscal year 2024, our 200 average employees provided $907,000 of charity care to the residents of all 24 towns. And this number wasn't in the letter that I presented with our request because we didn't have this data yet, but we provided Belmont residents with $79,180 in charity care. And if you're familiar with last year's number, that's a 67% increase in the charity care provided to Belmont residents. And I can explain further if you're interested why that occurred. 248 residents of Belmont accessed services here last year, and I would love to break that down in hours for you with that new electronic health record. I'm hoping that next year when I come to you, I can bring that, bring service hours, total service hours provided to you. Because I think 148 sounds, it's not as impressive as how many service hours, because many of those people come for hundreds of hours of service. Our request this year is again for the $14,000 that's based on the population of Belmont residents in our total catchment area. Belmont represents 8%. So that number has an actual mathematical formula. A couple of other things that you should know are this month in October, if you follow our social media, we opened open access intake appointments so that people can walk in and receive immediate access to services rather than waiting for an appointment. We're hoping that really helps speed up the proactive mental health service approach and eliminate, the wait times for care. And that's Tuesdays and Wednesdays from 8:30 to 11 a.m. here in Laconia for adult patients. Last year, Lakes Region Mental Health Center had a very difficult budget year, so I can certainly understand the town of Belmont's budget struggles. We experienced one of the toughest budget years in our history. It was a perfect storm of financial disasters, I guess you could say, across the state that was experienced by all of the community mental health centers, and that was due to the ending of the public health emergency, where thousands lost their enrollment to Medicaid and were no longer enrolled. When they did become enrolled, they were again subject to their Medicaid copay that oftentimes they cannot afford to pay, and that is what accounted for the huge increase in charity care provided year over year. So I hope that explains that. And let's see. I'm happy to answer any questions that you have.
I have no questions. discussion amongst the board after.
Any questions? All right, discussion?
So them and Costa are the only two that had no issue funding their request this year. I do have no issue even if we wanna go a little bit lower than their request, but they're the only ones that have guaranteed us an allocation for Belmont residents only, which I feel more comfortable giving the money that we know it's for Belmont residents.
Okay.
So what's he going with the 14,000? You made a motion for that?
I haven't made
You
any
did-
motion, I just want.
Oh, you
hear the
didn't make
board-
a
No, I
motion.
wanna hear the
Discussion.
board
Oh,
discussion.
discussion, oh, okay, I
What he said
can,
was this is guaranteed money that comes to Belmont, so if you
Yeah.
vote in the 14,000's coming to Belmont, some's not going to.
They mark it, so it's strictly for Belmont residents.
And obviously, they're giving far more than.
Yeah, clearly.
Obviously,
yeah.
that's clearly.
If there's no more discussion, I will make the motion, but
Any more? Johnny, any more discussion?
I'll make the motion to approve the 14,000 for Lake Tree Mental Health.
And I'll second it.
We have a motion and a second, all in favor?
Aye.
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 No opposition? Hearing none, 14.
Thank you for making that.
Thank you
clear.
very much.
Thank you for making that clear.
Thank you.
All right. We have Franklin VNA. No one's here.
Kristen Albert.
Good evening, everyone. My name is Sherry Murray. I'm here from Franklin VNA and Hospice. Also along with me is Kristen Albert, our CEO, and Nick Johnson, who is our Revenue Integrity Manager. Franklin VNA and Hospice is a small, nonprofit home health and hospice agency. We've been in business for going on 80 years. We service 14 towns in the Lakes region, one of which is Belmont. 17% of our staff actually reside in Belmont. So we provide home health services, hospice, and what we consider private duty, which is like our homemaking department. For home care services, we provide skilled nursing, rehab, which is your physical therapy, occupational therapy, speech therapy. We provide medical social worker, LNA services. Our hospice department is end-of-life care. 47% of our visits in the fiscal year that just ended, 2023 to 2024, were with hospice patients in the town of Belmont. And we also provide community health clinics, of which we provide 2 series of clinics in Belmont. For community health clinics, in the fiscal year that is ended, we have provided 2 flu clinics, along with 9 blood pressure clinics and some community health education, which is a variety of topics. If somebody reaches out to us and asks us to do presentations on anything from advanced directives to preventing falls, and any other topics, we gladly come out into the communities and perform education on those topics. Like I mentioned, or I meant to mention, in the fiscal year that just ended, we provided 668 visits to residents of Belmont, and like I said, of which 47% were hospice patients. That is an increase of 5% from the year before for the town of Belmont just for hospice, and a 3% increase for home health visits for residents of Belmont. Does anybody have any questions for us?
Any questions?
And we are able to set aside funds just for residents in Belmont. Our system allows for us to put things in by category, by town.
Discussion?
I'd like to make it,
Go ahead, dear. No? Okay, go ahead.
I'd like to change that to 2,500 instead of 4,000.
So we have a motion for 2,500. Do I have a second?
I'll second it.
Okay. All in favor of that?
Aye.
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 Aye. All right, 2,500 it is then. Thank you very much. Thank you. Okay, Partnership for Public Health. Hello there.
Hello, thank you for having me. Normally you see our Executive Director, Tammy Carmichael. My name is Carissa Elfett So we are a nonprofit public health organization that was formed in 2005 to address the unmet public health needs of the Greater Lakes region. So we serve all of Belmont County, of course, which includes Belmont, in addition, the towns of Franklin, Hill, Danbury, and Northfield. So New Hampshire, as opposed to our other neighboring states, does not have traditional public health departments. Manchester and Nashua do, but otherwise we're split into 13 regions across the state, so we are your local public health department on the community side. So we are tasked with public health initiatives that directly impact Belmont residents. We base our pillars, we have 4 pillars of service, human services, so we have and host the Aging and Disability Resource Center for Belmont County, which served almost 250 aging Belmont residents and caregivers to have information and resources to age in their homes safely. We know that New Hampshire's population demographics are changing, and by 2030, almost 25% of our population will be over the age of 80. In 2019, Belmont had a population of just under 16% older adults, so our population triangle is adjusting very quickly. So we currently serve Belmont residents to age in place. We also host a program called Wellness Link, which connects older adults to information on vaccines to stay healthy, to reduce social isolation, and to foster connections. And I was struck by your conversation about emergencies, the Partnership for Public Health. We have an emergency preparedness department. So we are active with the Town of Belmont and have invested in a 12-person rapid response trailer that is accessible to the Town of Belmont at any time. It will keep 12 people, up to 72 hours before the Red Cross can arrive, safe, and it is for sheltering individuals and pets, so it's available for the Town of Belmont at any time. We host community emergency response team at the Hewitt Center in Laconia for your Belmont high schoolers. We offer stop the bleed kits to the schools so they have access to stop massive bleeding and protect lives. We hosted school-based flu clinics to students here in Belmont. Last year we conducted, over the past 4 years we've had 335 flu vaccines for Belmont's youth, and our flu clinic in Belmont is coming up on the 21st through the 23rd, alternate with the different schools. So we're back in Belmont again, and it's thanks to your support last year that we're able to go right into the schools and offer flu vaccines to help keep the youth and teachers healthy. And we also offer substance misuse and suicide prevention education in your communities. So we work with educators under a community of practice, a learning community, so folks are connected to all the evidence-based tools that they need to promote youth substance misuse prevention, suicide prevention. We offer vaping prevention trainings that I'm working with students, and we actually brought trainers in last year to work with Belmont Middle and High School students to do vaping presentations. And we work with Belmont during Drug Take-Back Day and collect unused medications to get those out of unsafe places in homes. And over the course of Drug Take-Back Day, we collected almost 60 pounds of unused medications. That's 60 pounds of medication that didn't go into the hands of folks who shouldn't have it. So our request last year was for $3,000, and understandably with budget cuts, we're awarded $2,500. We did put our request in at $3,000 again this year, which is under 50 cents per resident for the Town of Belmont. And I'm happy to answer any questions that you may have.
The trailer that you talked about.
Yes.
Where is that?
It's parked at, it's been moved around a little bit, just depending on things. I believe it's parked up at Lakes Region Mutual Fire Aid, but the process is that your emergency management director, your fire chief, reaches out to our director of emergency preparedness, John Bueland. He's also a retired fire chief.
That was what I was gonna ask.
Yes.
That was, you answered
And
my
it's
second part of that question.
Available to the town whenever they might need it.
All right, okay. Do we have any questions? Any questions? I asked a question.
I'll make a motion to accept the 3,000.
I'll second.
Okay, all in favor?
Aye.
Aye.
All right, any opposition?
This you.
Hearing none, that passed. Thank you. We have a total?
Yes. So that brings your total selectmen approved health agencies to $63,400. So, and over what was requested and what was approved, the difference is $18,500.
All right.
This
what-
one, since it's not affected by health and dental and any other outstanding numbers that I do not have here, we could motion to, what did we say last night? It was accept or, accept as presented and or approved.
All right. I'll make that motion to accept as presented, a total of $63,400, which is your health agency, line. Do I have a second for that?
I'll second it.
Okay, all in favor?
Aye.
It's higher than I wanted, but aye.
Do what?
It's higher than I wanted, but aye.
Oh, all right. Aye, okay. No opposition, hearing none, the 63-4, we'll move on to the Budget Committee. Library trustees, number 5. Ladies? No ladies? One lady. Kathleen, how are you this evening? Why don't we just wait a second till Sharon comes back, if that's okay?
I have an administrative question for Alicia real quick, if you don't mind.
Go.
Alicia, I have a quick question. If these other departments have legal line, how do you know when it's used?
Oh, yeah.
Okay. I didn't know if there was like, they didn't want any of the select board or to be thrown to the side, like, and not know when legal issues are going on that we don't know about.
Yes, no, so the only other two who have, are you,
I see they have a
There's a
legal on
legal
there,
line,
so I
right.
had highlights I wanted to ask you.
yes, so I think those bills come specifically to me, and then they just tell me, how long you quoted and whatnot.
Okay.
Yes. And I think those, and they can touch base on that, but I think that's more, seeking legal advice, as well.
And we have a number of policies that, based on RSA's, they have to pass through legal.
Try to be legal, right, stay legal. Okay, floor is yours.
So I think this is my 9th time doing this, so.
Not your old hat then.
Given the delights of the default budget this year, we have been, closely scrutinizing our expenses. We've been looking at, things that we have done, things that we plan to do. We've been looking around to see where others, save costs. So that is, but we also want to, maintain a consistent level of service because it's important that the residents of the town are able to depend on the services that we offer. So I wanted to draw your attention to the documentation that I gave you, some of the hundreds of programs that we put on every through the year. We do story times, we do book groups, we have discussion groups and crochet. You should have seen the watercolor ladies, all ladies this today. There were 9 of them in the small area that we can allocate for them. It was a close fit, but they have a good time. We loan out lots of items. Our collection size is about 40% of other libraries in terms of our size. But but the residents borrow an awful lot of items. Each item in there is borrowed on average, 3 times a year. So there is that. We have the Library of Things, which includes a telescope, a metal detector, the literacy kits, that are for our youngest, our preschoolers. And, also we use 2 digital book services, and, Belmont residents are enthusiastic about that. The numbers keep increasing. Let's see. I want to, something that you may not be aware of is, our aid to, people who come in our door looking for, administrative aid with government services or charitable services. We get a lot of requests for photocopies, for helping people apply for fuel assistance. We, get asked for tax forms around the appropriate time. We get, that is, we back things with people. We, help them find the right phone number to communicate with a hospital. That is something that I don't think we always acknowledge. We like to talk about the fun stuff, the books and the programs, but that is also something that we do. So when I sat down to give my recommendations to the trustees, for this year's budget, I spent several hours, looking through, statistics, from our history and from the, peer libraries. There are 27 other libraries in New Hampshire that serve populations of Belmont size. A lot of them. Some of what they do doesn't apply. We're a lot smaller than some, but that also tends to be an advantage, that we have, because, we don't need as many resources, as some of them do. Let's see, so, I gave you the, I think you have the documentation for that as well, the comparable libraries, the peer libraries. So I'm not gonna go into that unless there's a specific question. But, after my research and my recommendations to the trustees spent, 2 meetings, I think about 2.5 hours total, combing over all my recommendations and, seeking out where we could possibly do a little bit better, save a little bit more, why do we need this. I really appreciate their diligence, to, make sure that we're presenting the most efficient, effective budget. And yes, so in the default budget, there may be something that's a little confusing. The default budget, we moved some things around so that we were able to, provide, we were able to provide to our employees the requested salary amounts for 2024, and we took that out of the, general expenses, so that we were able to fall within our default budget and still, compensate the staff for, the hard work that they put in. Yes, so we've been watching the expenses, we've been monitoring the categories. I'm pleased to say that we are well within the amounts, that we had. Looking ahead, though, some of those amounts are going to increase. Like the town, we are going to be looking for a new, website provider. That's a little bit more of an expense. And the popularity, one of the ebook services, cost is based on usage, and that usage continues to increase, and therefore the cost, while predictable, was also a factor in some of the general expenses we requested. So I want to thank, the staff for working hard this year. I want to thank the trustees, for their work as well, and, to the members of the community that, cheers on, tell good job. It is very much appreciated. I have, if you have any questions, I'd like to hear them.
Just a quick question about the website. Does you guys have a website? Does your like website platform do anything special for libraries, or is it just a general website?
No, it's the same provider as the town had. It's, what makes it specifically library is the links to the services. So, you know, so the website is separate, and then there's the databases that we also subscribe to. And one of those databases is our circulation system, if that's what you
Yeah, that makes a little sense, because my follow-up to that was more towards Colleen, if I remember correctly. Didn't our new website that we chose to use, doesn't it allow separate tabbing and all that, that we could have a library on there instead of having them pay for a new website?
I think there were recommendations of not to have the library be part of, and that was, I think, multiple. Do you remember why?
Well, we have a well-established domain name, and it's not, being a subset of that would make the domain, our domain be Town of Belmont .gov/library, so that the separate domains have been 15 years or so in the making.
That answer your question?
Yeah, a little bit.
Okay.
I have a question.
My technology brain is just digging up too
Yeah,
much now.
yeah, John?
So how did you cover the expense to your employees when the budget didn't pass last year? How did you overcome the shortcoming? Where did you find the money?
That was, so we went into the general expenses and we compared our 2023 actual spending against the general expenses. And we found places where I would say we had comfortable padding, and we were able to move it. The total cost of that was only about $11,000. So we were able to find in the general expenses.
Great thinking, thank you.
All right.
Thank you, good move.
So you'll also notice the increase on the salary, and Alicia, we've been working with the town, they could probably speak, we have to follow the federal law.
I did give them a handout today, to speak to that, but, in the handout that I did give you,
It's the earning threshold for the
Yeah,
executive.
put an exemption salary threshold.
Yeah.
I was questioning when I first saw your notes, 'cause it also says federal exemption. I'm like, which exemption? There's so many of them. Then I saw that when I came in, like, oh, I know what she's talking about now.
So if you look at the bottom part,
Yep.
you see the increase that really has taken place over the past few years that has to be met if you're going to pay somebody a salary and mark them as exempt. And there's all kinds of legal.
So which one of you is going to jail?
There's all kinds of legal criteria to hit that, but essentially you have to be the department head, you have to have so many people underneath you to be considered exempt, and salary. And if you do mark a person exempt salary, you have to pay them what the government wants us to pay them at this point, so.
And I did go into, the trustees had a workout, what an hourly position for me might look like. And actually, this is cost savings. If we went with the hourly route, we would actually, if I had access to overtime, we would be asking for a larger amount. So I think this is actually a cost savings to the town.
and I will add that with these new, fair labor standards, this is the only employee who, at this point, didn't meet or won't meet the standard as of 1/1/25. And anyone else that we have in the town who is considered a salary employee is above the threshold, so we don't have to do any wage adjustments for anyone else, just so you know. That's only in their budget. And I gave you that information.
Yeah. Okay. Do I have any other questions?
I'm just thinking.
You're so,
Yeah, I'm just burning my brain over here. Sorry.
So wood burn.
Repairs and maintenance, repairs and building maintenance, that's just general maintenance?
Yes, painting, if we flooded again, if we did,
So that would be insurance, I would
well,
think.
yeah, that's not a good
Yeah,
example.
that's not a good example.
That's not a good example,
All
but,
right.
Patrick did point out to me, a place outside where we were should have had the trim. And there are other things like that. Also, we get cleaning every other week, and that is.
Comes out of that, okay, all right.
And it's simple maintenance, like a plugged toilet.
I was gonna say, if the toilet breaks, that was gonna be mine.
When it's the big maintenance, we go to the Duffy Fund.
Yeah, if it's anything major, okay, all right. Okay. Any other questions?
At this point.
Okay,
So-
do I get a motion? Oh,
So I'll
You have
make the
a question,
motion to accept, oh, let him think.
I'm just trying to see if I can think of any wiggle room in the general library expenses, but I really can't see it. Alright, you're good.
all right, go Sharon,
So
before he has a second thought.
I will make the motion to accept the library's budget request for 2025
In the amount of?
in the amount of,
That number will change because of the numbers for the health insurance.
Okay, so we can't really
Okay.
accept this anyways, we'll just,
Well, the only
as
big
discussed.
line that we needed to discuss anyways was 999, so can't we make a number for 999? Which is the library general expenses, that's the only one that's really, all their expenses are categorized and that we have a say in.
I believe technically the Board of Selectmen doesn't even have a say in the library trustees' budget, it's more for discussion purposes into, library trustees are kind
We're
of.
voting on something we don't have any
I was
say.
gonna say, then why are we even doing this?
Well, it's what you don't have a say in how we find the money in the general expenses. What you do have a say is how much money the town is actually giving us.
Yeah, correct, so the only number we have an impact of changing the bottom line would be line 999, cause all the rest we have no impact, we have no say in the other ones, it's all set by, insurance rates and all that.
Right.
So the only number we have an impact on is that bottom.
but the problem,
Recommendation that goes to the budget committee.
right, typically we hold off until we've got this.
Okay.
Then one night we'll just sit here and go through,
The ones that have changes due to medical and dental and
Right.
life insurance rates, yeah.
right,
And as far as the town goes, what we're asking for is what was given to us previously, so that has not increased.
right,
Just so that you know, we have gone over every line item multiple times to try and figure out a way to get this accomplished.
You guys have an increase.
Yeah.
Last year you requested 67,100 in your general, now you're requesting 72,400, so you do have an increase. You have a 5% increase over the requested.
But I think what she means is like, so we've looked at the furnace, we've gone by exactly how the increase is on the electrical and on the furnace, and the only thing that's really changed is salaries and the benefits. We're taking from the town tells us how much our audit is, they told us previously how much our phone bill was. So we've it's only the general expense, we cut down on professional development.
awesome. All right, so basically we'll hold off before we,
You can do like we did last time and say approve as discussed, and then we'll bring back at the last meeting those numbers as the
Change.
final,
okay,
with the number
okay.
associated.
Do we need to have a mo-
Sharon, we need a second. Sharon made the motion, so we need a second.
Okay, I'll second it. All in favor?
Aye.
Aye.
Travis is all upset because he can't.
Listen, I'm trying. You're not, you're even harder, so don't worry.
And then I would you should ask permission from Rich to.
My gold star was the health agencies.
First cemetery trustees, if that's your intent.
Okay, I wasn't gonna say anything, but I can do that because they may. Yeah, I will. Madam Chair, may I step down, please?
You may.
Thank you.
Take a walk. Okay, Bree. Good evening. thank you.
How's the board doing?
Good. Doesn't do us any good to complain anyway, so.
No one's gonna listen.
Okay.
Okay, so I know the, operating budget looks very daunting with our number of 27.5, but that's with anticipated increase in fuel costs, equipment maintenance for the cemetery maintenance, emergency costs, professional development, database management, which we use Ancestry for. I use my personal time to create the database that we're trying to implement, so that's not really included in that. The Ancestry is though, so, you know, I know it's very daunting, it's bigger than what we had requested last year, but, you know, things are changing and things are getting more expensive and we have to, we're due to put out the contract with cemeteries out to bid pretty soon, like sometime in the next month or two, I believe. So it's gonna cost money for that to put it in the paper, and then we have no idea what people are gonna bid on all of these cemeteries, especially since we have two that don't have signs, one that hasn't been maintained since the sixties, that we just retained ownership in April through the public notice, which is Weymouth over on Brown Hill.
Mhm.
We currently have no access to that, no sign, it hasn't been cleaned, so.
So you can't even go to it anyways if you have no
Well,
access? Oh, you can walk to it. You have access to walk to it. You just don't have,
Direct access.
Got
We have the easement, but there's no walkway, roadway,
Yeah, right.
anything to access the cemetery.
Yep.
For cleaning, we had to access it through, someone else's property through the woods, and there's barely a trail to that. And as you can see through the photos in the first couple of pages, that is the current condition of Weymouth Cemetery.
is that what it is?
Is that the headstone right there on that one?
I'm sorry?
Is that the headstone or is that just a rock?
So we were not able to locate any actual headstones, those are probably field markers, but it's, according to our records, there are at least 20 people buried in that cemetery. So when it comes time to clean, we do have to do some extensive research on the area to see if there are any stones remaining for those.
Is this the one that we thought that there was a stone in somebody's cellar?
Yeah, in the foundation of.
In the foundation?
Oh,
Is that the
jeez.
one?
Yes, there's speculation that someone used the stones as part of the foundation of their home.
Mhm.
We did the previous trustees did contact that homeowner and said, you know, if you, or someone bought that home, they were gonna tear it down. The previous trustee approached them and said, if you're gonna do that, please let us come in and see if we can locate and get any of our stones back, and they tore it down, threw it in a dumpster, and it was hauled away. So, as far as we know, there are no stones remaining, but we do need to make sure. And if there aren't, then we need to take steps to, rectify that eventually, but.
So these bull pines that have fallen?
They're
Oh.
inside the cemetery.
Yeah, yeah.
Mhm.
Do you have any records of the names of people that are in there?
I have a lead on that. They said Sanborn and Farah and Page, family members there. So I'm gonna use the Ancestry database to go back. And see if any of the death records will show them actually being buried there. But other than that, there's really to know. The only historical information we have is Warren Page in 1935 when he was in there mowing, some little boy told him, my daddy took the stones. That literally is the only, and nobody's been out there. I think the last time anyone was out there was 1969, Wallace Road and Helen Hill walked out there. And they're the ones that actually made that note, so other than that, there's no information.
The person that owns this property?
It's,
The town does.
The town owns the
So
cemetery,
we-
but we
Well, we
haven't
own the
actually.
cemetery, but,
so the land was, Mary, Holland's property.
Ariane Hollins.
Yeah, it's now owned by Brian Hamilton and his wife, and we accessed it through Bob and Melissa Atherton's property.
Mhm.
Bob has an interest in seeing it, cleaned
Yeah,
up.
yeah.
So he allowed us to walk out that way. But I would like to mention that the pictures and stuff, that is for
Our capital
the
reserve.
capital reserve
request.
class,
Yeah.
not the
We have
general
projects.
Okay.
for that.
all right.
But this, operating
Okay.
is maintenance, and Weymouth will eventually become part of that maintenance contract once it's been.
So we're not looking at a budget for the year, we're looking at just this capital reserve right now.
No, no, the budget.
No, this
No, we're
is,
discussing, so
What I
he's
missed?
looking at the pictures for capital reserve, just so
You
you
might
guys
have put
can
this-
see
you
what
put it in
the
front of it.
current
Oh, I did.
position
There's the budget
That
here.
will be part of our operating budget.
That can't be the whole budget.
Yeah.
That can't be.
Cemetery general.
How much do you pay a guy to maintain the cemeteries?
So this past year, it was 17,600 for 2024. It was 17,000 for 2023, but we added Lad Hill onto the contract for this year, hence the $600 discrepancy between the 2 years. But we are due to bid it out again in December? Yeah, in December, for the next 2 years potentially, so, yes.
You can correct me if I'm wrong, but didn't you guys use a lot of your capital fund this year to help offset the budget?
We did, we gave the town back $8,750, which was the cost of two maintenance payments this year, which those payments came out of our capital reserve to make up, because we weren't gonna have enough in our general.
So that explains why your actual is 9,704.
Yes,
Well, we had the money in our default budget, but we had a different way to pay for it, so we had a conversation with Alicia and we gave back
part of
the
the default.
8,000 to help with the budget.
just think all these people that have passed away helped our default budget this year. Right? If you wanna think of it that way. Well, okay. Any questions?
Give me a second, I'll burn some brains.
He's,
Well, I mean, everybody knows everything's gone up this year, well, in the last couple of years. So you know the maintenance contract's gonna go up, that's understandable, you know? That's why we're asking for so much, you know? We don't know what it's gonna be. I mean, Sonny, you were in the landscaping business, you know, things fluctuate up and down and.
Ain't
Oh,
much
yeah.
down.
Say there ain't no going down.
No, the weather isn't, you know, but, yeah, I mean, everything has gone up dramatically, so.
Yeah, supplies has
So-
tripled on us.
I would still like to mention if I can, given the balance of what we still have, so we have a balance, from what's left in our operating budget, which is,
1855, I believe is what we
So-
have right now.
we're still going to, pay the fourth installment of our maintenance contract out of the capital reserve. So barring an emergency situation, this is potentially money that can go back into the general fund. And, also, personally, when I get a second, I am still looking into using the perpetual care funds by, and I probably will use Churchill to send the trustees a bill. And then that would then be money that would come back to the town. I believe that goes back into the general fund, but I'm not 100% sure how that works exactly
And
yet.
the perpetual care is a lot of math, because it's a
But
different
that's
amount.
Yep, for different
Per
people.
grave site.
I'll start that on Thursday.
Yeah, all revenue would hit the general fund.
any more discussions or questions?
I'm gonna abstain from this vote.
So, what are we actually voting on here? I'm just kinda lost a little bit.
I would
in this.
say that the request is for 27,500. Their previous request
22.
was 22,600. That was in 2024. So they are,
What's that 27.5 include?
well, it's over to the
The
right.
maintenance money is not come,
So it's
Yeah.
for
Maintenance,
maintenance
legal,
mostly,
supplies,
that's the
training,
biggest chunk
yes.
of our funding. So we need to get a sign for Lad Hill and a sign for Weymouth at the minimum, because they need to be marked. Neither one of them are, and according to the RSA, they do need to be marked. We do need to find a way to get access to Weymouth, so that could be included in that, or at least a start to a walkway just to get to it. And then, legal fees, for doing a side pay petition, potentially, we're not 100% set on that yet when it comes to perpetual care funds. If we
find a way to use those instead of going that route, we will. It also includes, the ancestry that we use for our database management to trace back ancestors as far as we can to the people that are buried here. That's pretty, and emergencies, just in case there's storm damage and trees need to be cleaned up, it helps cover us for that too. And I know we have the capital reserve for that, but, the packet that I gave you shows some projects that we really need to do using those capital reserve funds. So, the operating budget is really what we have to work with, and I know the number looks really daunting,
Well,
we're just anticipating.
I'll make a motion to accept that 27.5 for cemetery trustees.
I'll second it.
All in favor?
Aye.
Aye.
Okay. And John abstains.
You're welcome.
Thank you.
Have a good day.
All right, thank you.
Do I have to speak on heritage, cause she's not here? What the heck?
I'm speaking on her behalf.
Oh, thank you, cause I'm like, wait a minute, I'm looking around like, where is she?
Okay, the next one is the Heritage. That would be number 7.
Number 7, I provided you with a handout that Vicki had given us from the Heritage Commission, in the additional. They're making no change to their requested, they've requested $250 into their, budget for years and years and years, and then they're asking for $4,500 for their capital reserve. She highlighted that in 24, they did the Community Heritage Awards, they did the printing of the Belmont historical booklets for 4th graders, they did a senior citizen food drive, organized with the Belmont senior citizens and coordinated with the elementary staff and students. They paid for the band at Old Home Day, they installed 11 new banners throughout the village. They, out of this $250, they paid for the Preservation Alliance membership dues, and they sponsored a presentation last Saturday honoring Linda Frawley, including a memorial plaque and garden area.
Any discussion?
Question though, real quick, am I allowed to vote on it? I'm the board member on there,
I don't see why not.
just wanna make sure.
This is where I got confused on the previous, because they're asking for their general fund money right up front. They're calling it their general fund, that $4,500.
Oh, the heritage one, yeah.
And the cemetery commission, that wasn't so listed as that. See, so where do they get the money for their, general expense fund? I mean, she kept saying the capital, we're gonna take it out of capital reserve. Who gives them the allotment for capital reserves every year?
The voters do at town meeting, so they would put a warrant article out for their capital reserves, you just.
The town officials and the budget committee have no say at all.
You do, you can agree or disagree with the amount that they're going to put forward come that time. So let's say they're gonna bring forward 20,000, and you say, no, we can have 10,000, so then that time
Okay.
goes to the budget committee, then they can.
All right.
do the song and
So
dance.
technically Heritage Fund didn't have to list that on there, their
No.
fund balance, their
Yeah.
warrant article number.
Well, they don't, right, because, the capital monies are done under the capital
Yep.
account,
Yeah, for some
and
reason.
they don't have a capital
Yeah,
account,
Hillary
really.
was just
The
confused.
budget sheets were always had there, the Heritage Fund's capital reserve in this line for some reason, and it's never just been changed. or
So
anything,
technically their
but-
budget's 250 and then the
And that's why it says
4,500.
off article,
Yeah, oh, okay, I see that now, yeah.
I'll make a motion to accept the $47,500.
I'll second.
$4,750.
Okay, do I have a second?
Sharon did.
Sharon seconded it?
Yeah.
Okay, all in favor?
Aye.
Aye. Okay, let's move on to
Donna.
general assistance.
Oh, boy, I can't wait.
I know, do you wanna get up and leave?
I'd like to.
Sure you will.
Did you bring pizza?
So, yeah,
But right now I could eat some.
yeah, before we get
Have
into,
something else with it.
before we get into this, thank you so much for that.
Yeah,
You
I
have,
appreciate
Oh,
it was a
everybody looks so wilted, and
lifesaver.
This man just gave me, because I helped him relocate.
Right.
He gave me this, he came in and gave me this $60 gift card
Well, I believe it's a town policy, after so many hours, you get a break.
Well, I was kinda thinking
So I don't wanna know
that.
when and who, I see that happen in the town office. Oh no, I'm on break now.
Well, she started it because she said pizza like at 11:30. We were talking
she
about
did?
something and Alicia mentioned
I
pizza.
honestly, I didn't get any
We're
texts from her. No, it was just weird, and it was warm. I mean, I left here going, and I saw that, and I said, oh God, they're gonna think this is bribery or something. Somebody, I was trying to figure out who was being.
That's
It's
okay,
okay.
we accept bribes.
But anyhow, moving right along.
Great, oh, great.
Oh, good Lord.
That just went
That's
everywhere.
recorded.
So thank you.
You certainly.
They think it anyway, where the hell do?
So how did you manage to
What, do
get
you win it for the money?
7%?
Oh, yeah.
Donna,
No, it's on the same.
how do you manage to get 7% when you usually keep it down around 3?
Okay, so Sunny, it's worse than that. And I'll be really upfront. I gave you just. This is really just garbage, but maybe it'll help Sunny understand.
What a smile.
Sunny day
Boy, I'm telling you, I know where you're coming from.
It's just garbage, but
Yeah,
Cindy.
it's nothing really.
I did it for Sunny.
It just kind of gives us an explanation of a few things as we target, the impossible.
Yeah, I saw this yesterday. A 4-bedroom apartment in Laconia was $3,100.
It's ugly.
I love
I was
that where
like-
I live still. I'm not gonna-
Is it still the same people that own it?
Oh yeah, he's a great guy too. I love it. I'm gonna keep
I
shining
love
his whistle every time.
I used to be able to close it. Kind of miss their presence here. So anyhow, long story short is, I can give you the overview. It's, the homeless population is 2/3 of our population, and it's not going away. It's uglier. You guys know how long I've been doing this for, and I've never, ever gone over my budget, ever. I've never gone over my budget, meaning using other lines to offset another one. And, the housing line right now that you have in front of you says that I've used $93,012, and that's not accurate.
That's worse than we say.
It's worse than that. I've used $98,686 that Steve and I talked today, just hasn't got posted yet. The hotel motels, okay, are out of control, and I have a very good working relationship with one particular place that has probably saved us, cause otherwise, we'd probably be looking right now at probably 165, 170. And if I had to use the Super 8 or some of these other ones, I have a negotiated rate, and I kind of chatted with you guys a little bit before, I ain't doing too much disclosure of it, cause everybody under the sun will be running and trying to take my rooms.
Yep.
But, it averages out to be $40 a day. Now, the cases that I have, for the most part, I have one room that I float. People in, people out. Beds are out of it, there's cots, you'll see when the payrolls come out, I just bought 2 more cots, because mine are totally demolished. And what I do is I put 2 cots in a room. And the motel owner, primarily has put responsibility on myself, and actually the city of Laconia equally the same, where we occupy pretty much a good percent of his building. And the way we have the arrangement is that we pay him, and he has nothing to do with,
No
the
service,
rooms that we
nothing,
rent.
nothing, yeah.
And those rooms are not rental rooms, they're classified as shelter rooms. They have to sign a shelter contract with me that says that, no different than being at the Carey House or another shelter, that, there's certain rules, there's regs, they have to fly by, I mean, they're doing job searches, apartment searches if they have capabilities, or there aren't exceptions, and medical. And basically, if they default, I don't have to evict anybody. I can say, get your stuff, you're out. The problem is the law
changed. And so if I remove somebody today, they are sanctioned for 7 days. If they have no money, they can come back. And we start all over again. So we're constantly chasing our tail on who's who, and it's just a fluid population. Shelters are full. Every day I call, I get my, Donna, we really don't want to hear your voice. It is what it is. My biggest issue right now is domestic violence, DVs. And I am struggling like I've never struggled before on getting some of these individuals placed. We have dealt
What happened with all the federal money that was supposed to help all of the, you know,
DV.
Just get them a gun, right? Give them a gun.
I thought we had federal monies that was
Well,
gonna.
we have several shelters, that, I just placed, here's a good example. I just placed an individual, a middle-aged individual, who was, talked to Alicia about this, in a wheelchair, and a home, trailer park. Husband was aging, he's about 20 years older than her. She broke her ankle, was put in a wheelchair, hasn't been out of the wheelchair in 5 years. Dementia set in. His behavior started becoming aggressive. PD kept going back and forth. Elderly and Protective Services, we got a guardian for him. His family member came up from a southern state, picked him up. He went to the mobile home park and he signed over the park to the trailer. The trailer over to the park. The wife is still in the mobile home. Okay. Oh yeah. And not only was the wife in the home, but that she's disabled.
Oh, sure, yeah.
I learned of this like 3 weeks before the demo, because they went and got a demolition permit, the trailer park, he signed off. Could we have stalled it, paid $300, $3,400, kept her there, she got no money, it's not gonna work, so all we're gonna do is pay good money against bad money and have it deteriorate underneath her. The long and the short of it is, I called Bureau of Protective Services, Elderly and Protective Services. I said, I have a disabled woman, really, what does she get for Social Security? I said, she hasn't been to a doctor, we have to get her to a doctor, we have to get services in place. You guys, she's not disabled. She might be sitting in a wheelchair and she may say she's disabled, but unless I get a doctor to say I'm disabled. Now this is a small amount of complexity. So in the meantime, they're gonna bring the boom. They're knocking this place down. She's gotta go. And I'm like, on top of it, everything else and all these other people and so on and so forth. Long story short, moving fast forward, I worked for like 3 weeks. I bartered time at the trailer park. God love Kate's Trailer Park. I'm telling you, they will work with me any day of the week. And I called all the local shelters and nobody had space for it. So finally, I talked to some people that I know very closely, I work very closely with, and they connected me to a shelter that agreed to allow for this woman to go there, because she's handicapped, she's in a wheelchair, they needed to wrap around services, blah, blah, blah. I assisted, you could say, getting, like, the room needed cleaned, and this and that. You do what you have to do to move people along, and at the end of the day, she'll get the services she needs. So domestic violence is a very interesting place to try to get people situated, and the time that it takes, especially if there's kids, it's crazy, because there's no shelter rooms for, they might have 1 or 2 family rooms. So you start calling, there's a phone bank, and they say, yeah, Concord has a handicap bed. So I called Concord. Well, where is she from? Well, what is her issues? Blah, blah, blah. Ted was given up this weekend. The Beginnings, favorite shelter. Yeah, Donna, we don't have any space.
Well, she said they have, what, 6 beds?
They're all full probably, yeah.
They're full. And so anyhow, but my point is, the homeless, and this woman's homeless, domestic violence cases, when the police department comes in and tells you about how many DVs it takes, I mean, hours, because of the red tape that's associated to, you can do this, you can't do this, you gotta do this, you gotta do that, and then just when you get there, it feels like everybody changes the rules again. And, but at the end of the day, basically, if you just look down that little list that I gave you, I mean, people go to the emergency room calls, sends them in a taxi. I mean, I get taxis, people dropped off. I'm like, okay, what are we gonna do today? And so, I do have a really, really good working relationship with, community actions, housing stability, and street outreach, which, thank goodness, they help me move people into either rooming houses or whatever. But this motel that, I utilize has been probably the biggest savior we have. And I put in a budget, request for, $95,000, that's not even gonna touch it. If the pace continues to go at the level it's going, I'm renting, tentatively, I have 4 rooms, and then he just opened up, the cottages, which are kind of self-serving, which is really nice, so now I'm not, dealing with like the food piece and some other, factors. And so 4 rooms and 2 cottages, the 4 rooms are $4,500 a month, the 2 cottages are, $2,800 a month, that's $7,300 a month, times 12 months is $87,600.
Jesus Christ.
Now, that's not counting our regular people. I mean, regular people, like, you know what, Donna, you know, I lost my job, I've got no childcare, my boyfriend, my husband, or my girlfriend, you know, vice versa. Always, I catch myself, and I really need to catch it harder, because guys get a really bum rap, I'm gonna tell you, they really do. And they're not all deadbeats. I mean, there are an awful lot of abusive women, and there are a lot of other situations that people don't look at. Dad gets left with 2 or 3 kids, he works full time, what do? You know, takes a little time off, boss says can't happen, trying to coordinate childcare and all these other services, but you know, it's chasing people and trying to put systems in place, and once they do, we remove ourselves, because we've kind of moved them on, but until, it's a disaster, it really is.
Are you talking about that cottage for $4,500 a month, is that what you said?
No.
No, I misled you then?
No. A cottage is $1,400 a month.
Oh,
So if I'm
$1,400.
renting 2 of them, that's $2,800.
Well, where'd the $4,500 come from, you
The
guys?
$4,500 is the 4 rooms that I rent.
4 rooms?
Yes, and right
And
now.
where's that located at?
Same place.
Same place, it's in the same place, they have a.
Well, where's the same place?
You can't
You
really.
obviously didn't read between the lines.
Well, I'm sure there's,
I don't care. It's
I-
the Winnipesaukee Motel up at the Weirs. That's the place. It's not the Hilton by any means.
so why did you pick this place? Is that the only
Okay,
place?
so
you-
Sonny, let me do the math with you, okay, just so we get on the same, like you can understand. If a room is $1,200 a month, and we divide that amongst 30 days, that's $40 a night. The super rate is $127 a night, 140 something. Maybe I might be able to get it for 105, depending upon what day and what mood somebody's in. The Econo Lodge, I just cut another deal with. negotiated with fuel assistance, the cab people. And that's at $77 a night, as long as I buy 5 days. Okay? So, I am not only doing crisis management, but I feel like I'm a car salesperson too.
Easy with the car sales.
Let me rephrase that, a used car salesman.
Used cars.
I know a few of them too.
Oh, no, all due respect, I mean, we have an amazing deal, it's more than amazing, to be honest with you. Because the population is so fluid that if I can move people in and out, there's no services. You get a room, you get a bed, you get a microwave, you get a refrigerator, you get a TV,
Do you get a bathroom?
and you have a bathroom.
Thank you, that's all.
You have to feed them too, or what?
No, that's coordinating other services, like when CAP was here and they were talking about community action, like Meals on Wheels and all of these other services, you know, but I have 3 in rooms that have been there for a long time, they're medical. And trying to get what they call CFI, Choices for Independent Living, that's wraparound services. I mean, these things drag forever. They have no money. They're one girl's making $460 a month. Yep. And the other one, they're like $1,040 or.
And the scary part with this is that the economy's good right now.
Oh, come on, don't fool us.
What's gonna happen when the economy starts sliding, people start losing their jobs? It's gonna increase even more, the homelessness.
Well, that's ultimately what kills me, is this general assistance was originally put in the law to help true residents of the area. Now we're just end up footing the bill for the homeless that get kicked out of Laconia sent to Belmont. And I know you have no control over that, and that's the only thing that kills me, is we're now footing the bill for people getting kicked out of Laconia.
And yes and no, kinda. So the legislature went and said, they changed the law a little bit, that we're supposed to go and do the research back to figure out where their history of origin was. Where did they last stay that they paid something? Well, if you're chronically homeless, do you know how much time this takes? I mean, to keep, nope, sorry, yep, nope, we never had landlords, they give cousins, friends, uncles, they've been just transient forever. There's another population, but if they are in the town of Belmont for more than 30 days, then they're ours.
Mm-hmm.
And so, the deal is try to, there's a lot of people that are in, this sounds so awful, like every single person is a certain in a certain categorical group. It's not. The crises that are going on, and you see, for a 2-bedroom apartment, you have to be making $73,000 a year. One other theory was 68 or so. Wages are still substandard. They are not where they need to be. And unfortunately, you can say, well, we can't afford it. You almost cannot afford it, because it's ridiculous that, well, we see it. Look at the city of Laconia. Pull in there, $64,000 for an uncertified. I don't care if it's the city of Laconia or not. That's a lot of money. And they've just filled, 2 positions, 3 positions? It's like, so what we do is, we freeze wages, but the cost of living keeps coming up. So how do you retain somebody that still has to pay the same bills as everybody else? And it's just like this teeter-totter that won't stop.
Well, we see that with the police department. We're losing another guy, going to another community.
Bought out. It's
We're gonna have none at the rate we're going.
You're gonna have to look at things maybe a little differently,
Yeah.
but that's not why I'm here.
No.
So anyhow, if you wanna go through my budget, I'd be happy to, but there are some numbers that have to change. And if you disagree, you guys bear the whoopee button. Before we go any further, I do want you to know something, that I collected $9,954 though. Cause some of those people that are in those rooms, if they have some money and I do a budget on them, I then request a certain amount of money as not rent, but as their shelter contribution. So I have one man who pays $500, gets $1,000, that covers his transportation, that covers his cell phone, okay, and some medical needs.
And a pizza
He
card.
keeps 5, we keep, and we get 5, okay?
I didn't know you could do that.
Well, guess what? Me neither, working. But not all of them, and I mean, more not than some, but in this process this year, which sounds like ridiculous, yeah, you spent how much money on it, 98,000, and you're saying you made 10 back, you know, you saved 10. But it also it gives them, you know, they have some responsibility too, and some ownership. So, but anyhow.
It's a tough world out there right now, I'll tell you.
Very
Ooh.
ugly, more than
Boy.
ugly.
So, I don't know, that's, must put a lot of strain on your shoulders trying to
It is, in fact,
bring
this
this all.
weekend, Friday night, I got a call, and I didn't answer it, and I listened to it, and it was somebody here in town that thought that they had their arrearages paid, and Keystone Management already had a writ with the whole arrangement, and they didn't get the money. So, they were able to make contact with that person, I don't know how, and she said, well, the town will pay $3,000 in the arrears. I said, so here I am, Saturday, boom, 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 back and forth, and then finally, at 7 o'clock last night, we put a plan together based on 3 other charitable organizations stepping up. But that would have been a woman and an autistic adult that lives with her on the street. So, but it doesn't end, and you know, I don't have to answer those phones, but if I came in here this morning and had those 2, I'm worried, I don't have any rooms left. I don't wanna spend the big dollars, you know, somewhere else, so.
There's no money from the government that you could try to drag in here?
That
Huh?
money's gone.
Yeah.
In fact, it was $1,800 for what they called rapid rehousing that Community Action had, and those monies are gone. Honestly, Travis, every county in the state should have their own shelter. They really should. And, I mean, because this is no longer a town or a city issue. This is really, I mean, it's global, but never mind global, state-wise, I mean, we shouldn't be like treating our people like second world countries. I mean, we should be able to take care of our own. And, you know, you have a Carey house, it's, I mean, horrific to get people in there. I mean, they're full. I mean, so it's no fault of theirs. You know, all the different shelters, they're chock-a-block full. And we're stuck. It's on the backs of, you know, cities and towns. And
It's more cost efficient to attack it from the county level at least.
I think so too.
It's
I
what?
think
More cost efficient to attack it from the county level.
I agree with you. I mean, we pay county, county
Monies to the
taxes.
county.
It would obviously reflect major changes, but the state would have to partner, and then the state can reach out for some other federal funds. But I don't think it's really been explored, but again, do you really want a shelter in your backyard? You know, it's only.
Your backyard's
it's like,
gonna
well,
turn
do
into
you
a
want-
shelter soon if it doesn't happen, so.
Well, do you want tents in your backyard?
I was just gonna say, a shelter or tents in your backyard,
it's
that's what's
either
gonna come
way.
to.
It's whatever. Okay, let's start at the top. So, my wages will be the same as 2024. Somehow there was a different number that got posted in there that I thought I had, said was gonna stay, neutral.
So are you not taking a wage adjustment?
That's correct, Yep.
So you're changing that back to 76, that's what
I
you're
am,
doing? Huh?
I am,
You are, okay,
yeah.
okay.
The problem is, Sonny, is, in my words, honest to God, and I've never, ever promoted myself. I'm worth more than $100,000 right now. But the flip side of it is when people look at numbers, they don't look at experience and they don't look at how many years? I've been doing this for over 30 years. So if you wanna pass budgets, you better look at things a
No,
little
I think
different.
you're doing a hell of a job. I was talking to wife the other night about it. I said, you know, boy, if Donna retires, boy, we're gonna be in trouble here, 'cause it's gonna be hard to find somebody to do what you do. And I'm not trying to bribe her or nothing, I'm just,
Going for a while.
The unfortunate thing is there's not gonna be anyone out there that does
no, well, I
this.
know that, and that's what I'm saying. And
Well, they will, I mean, you know.
I know, but not on the same level. And most people do not understand, don't have a clue.
no, they don't.
I have no issue, she has some changes she wanted to make, that's why I needed.
So anyhow, so the top part of my budget, I mean, I think is where it needs to be. I don't think there's anything there that should be tweaked.
What's a part-time labor? What's that?
That is like one of these times, like I go away for 3 weeks, I'm gonna go away for a week, I'm gonna fly home for a week, and then I'm gone for 2 weeks. If heck breaks loose like there's no tomorrow, I'm gonna have to pick up the phone, and we'll do it, and Alicia and I have already talked about this. I mean, I have somebody that I can trust enough to
Fill in the void.
run things by me. When I go away, the house we rent looks like Wall Street. It's got my, you know, everything. But again, the population is so fluid. If bad things start to happen, we need coverage. I mean, I had 2,400 in there before.
Yeah.
Because you're gonna pay somebody $30 an hour to, you know, fill in, so it can get absorbed really quick. So we're gonna leave that in there, whether we
Yeah,
use it or
no,
not.
no. I just thought I'd ask and see.
No, and I'm glad you did, just so that, you know, walk away and, educated.
Can I speak now?
Yeah, shoot.
Under general assistance from lines 1014441-101 through 1014441-505, I move to accept as proposed.
I'll second that. All in favor?
Aye.
There you go.
Then we'll go to 01444, I think 4445430 to 014445441,
We have to change some numbers there.
okay? We're gonna
There's no
discuss
way.
that section right now.
Right, the housing line, there is absolutely no way that we're gonna, honestly, it should be 135 to 140. As much as it'll take your breath away, I mean, and if we don't use it, awesome.
It comes back, okay?
But
Hey,
that's,
so instead of the 72, what do you wanna put in there?
No, it's 95.
No, it's 95. Instead of the 95, you wanna put 140 in?
well, it's already at 98.
Well, 98,
And
right.
we have still 2 months, which is gonna equate.
Nine. Yeah, it's gonna be well over 100.
Sort of 20, right now, there's, $18,000 that I can calculate, and then it's whatever other, you know, drips and, I think we need to put 140 in there.
Okay. And you're probably still not gonna have enough, unless something drastic changes.
Everything else that I put in, I think works.
So it's just to change the housing line.
Yeah, the house.
I have no issue with that change, but I do have to head out,
Okay,
sorry.
all right. Thank you, Travis.
Thank you.
Swing in anytime.
See you tomorrow.
Oh yeah, I'll be here tomorrow.
Yeah.
Tomorrow?
So, that line,
Tomorrow already.
So you're adding 35 to that 213, right?
So that brings it bottom portion to 158,775.
158,775, okay. And then we're adding, so we add the 158,775 and the 99,558, correct?
Well,
No.
Donna is giving back part of her salary.
Oh, that's right, the 79 is going to,
So there's
76.
3,000 there, but then there's gotta be adjustments in the other numbers.
Yeah, that's
too.
right. See, we can't finish this because, again, there's gonna be adjustments in the Medicare.
No, I mean, if you wanna
Yeah.
talk
No,
about
sir.
something different.
Huh?
Yeah, she can, cause she has those
On
numbers.
the fly right now,
Oh,
On the
does she?
fly, if you
Oh,
just-
oh, she's on the fly.
1%.
Okay. So we know what the insurance is gonna be?
I don't know the insurance, but I think her insurance is in my budget,
Yeah, I don't see it here.
yeah. Her insurance is in mine, but I can give you the rest of the other ones.
All we need is a bottom line. All I need is a bottom line.
I mean, not that the other numbers go down much, but it's still, it'll offset a little bit.
It's basically out of, it's not, you can't control it. I mean, you'd like to, but you can't.
Right.
It's all right.
And the unfortunate thing is even if yours goes over budget, we still have to cover it. Even if say the bottom line is $300,000 and it goes to $350, we have no choice. As a town, we have to cover that. Oh.
There's only two departments, legal and welfare, that, for lack of better words, are boundaryless, which.
No. People don't understand that this is one thing that we can put any number on it.
I never would have ever
No.
even been able to absorb what's happened, really, and the cost. It's,
There's,
every time I go to spend it, I go, nah, there's got to be more money now.
What's the number? She's gotta pay.
she's gonna get it. Well, I think I sent that out, the home that was, a home in this town was purchased in December of last year, December of 2023, for $330,000. It's on the market right now, less than a year later, for $660, I believe.
Well, the
Alright,
third house
so
up
your
on
new
Levitt Road.
adjustment for the general assistance and assistance to vendor payments, so your total bottom number is $254,709,
709?
correct?
I'll make a motion that we, accept this budget and move it forward for $254,709.
I'll second.
All in favor?
Aye.
Aye.
Well, thanks for your support,
Yep,
appreciate it.
it's, I don't know how you do it, Donna.
You need that, you say. It's frustrating,
It is.
it's really frustrating, because every time you think you get your hands around something,
Yep. Well, that and the laws change, it's trying to keep up with the,
this law, the welfare, RSA 165 is 200 years old, and nobody wants to touch it.
Of course not,
All
it's New
about
Hampshire.
local control.
Live free.
Well, it's all about local control. So, the minute you start tweaking, the Nashua may be different than the Pittsburgh, New Hampshire. And the minute so we try to take little pieces, and.
as they say, live free or die, we're all gonna die paying property taxes in this state.
So the state of New Hampshire can figure out how to fund education,
Oh.
unfortunately.
Yep, and they
Good
don't-
luck with that.
And they don't wanna touch that with a 10-foot pole. Can I have a motion to adjourn?
So moved.
Seconded. All in favor?
Aye.
Aye. See you tomorrow night, same time, same channel.
Cynthia said there the other day, in 1996, we bought the house in Week, right? Paid $112,000.